It's a long-standing policy creating increased tension at Dufferin Place in Nanaimo. Mental illness and addiction patients under the age of 60 living at the same long-term care home as elderly patients.
There are people with very different concerns and very different challenges in long-term care.
The big difference at Dufferin Place is how different each type of patient is to deal with, raising concerns. Staff are not trained to handle both a young brain injury patient with addictions issues and an elderly patient with Alzheimer's.
Dealing with residents with problematic behavior due to brain injuries from whatever cause, whether it's trauma or whether it's chronic use of drugs, you're going to need a different staff mix.
While there are some patients with brain injuries in community care, others are in long-term care, although that number has remained stable. 92 patients across the province in 2022, 100 in 2023, and 97 in 2024. But advocates say brain injuries, especially linked to drug use, continue to be underreported and are on the rise.
Brain injury is actually more prevalent than HIV, spinal cord injuries, and cancer all combined, and I believe the supports receive a fraction of the funding even in comparison to those other conditions.
The province is investing more in terms of funding and research into brain injuries. In terms of living conditions, they are focused in on patient care and the concerns of staff, ensuring that these younger patients are put in separate areas or are in pods of their own.
We've also put in specialized areas in lots of care homes that keep people who are all qualified for long-term care but have very different needs in long-term care. It increases not just safety but a sense of safety.
Residents have also complained of a rise in drug dealers near healthcare facilities, something Dick says is illegal on site, and security deals with the issue when they're made aware. Richard Zussman, Global News, Victoria.